Mucormycosis after COVID-19. What is this black fungus that everybody is talking about? It's normally seen in the air. It has been existing all these years. It's seen in your bathrooms in some wet areas which are not cleaned. It is seen in old food material which is lying outside. It grows very rampantly everywhere. But now why is it suddenly so important? It's because now we are seeing it in many COVID patients or people who have just recovered from COVID. What is this reason? Why are we seeing it in these COVID patients? One is uncontrolled diabetes. One is the treatment that we're using for COVID involves steroids, which again messes up with our blood sugars. And this COVID virus itself is messing up with the immune system of the body, preventing it from fighting newer infections which are affecting the patients after COVID. How can we know that this is a new infection that we are developing? It usually enters the body through the nose because we inhale these fungal spores. So these are the symptoms that we can make us suspect that we might be having a new infection. One is suddenly we are having a bloody nasal discharge, or we have blackish discoloration appearing in the nose, or we suddenly develop facial swelling on only one side of the face, a different kind of sensation of tingling or numbness over the face, and then we have swelling only around the eye, or we develop a double vision or inability of the eye to move sideways, or we have a sudden decrease in the vision. So when we develop these symptoms suddenly, we need to suspect whether we're developing a new fungal infection. Now what do we do after COVID, after this home quarantine or after hospitalization, so that we don't develop this new infection? One is we control our blood sugars. We make sure we take our medications properly and we are in touch with the diabetes doctor. Two is as soon as we go home, we follow good hygiene. We take bath regularly. We follow good oral hygiene where we brush our teeth regularly. We use betadine mouthwash, or we use a warm saline salt water gargle so that we decrease the pathogens which are entering our body. And then we can also have a good healthy diet, do good deep breathing exercises. These small measures will help reduce the chance of us developing fungal infection. When do we need to report to the doctor? Like I said, if we develop any new symptoms or any of the signs that I said previously, we need to immediately report to the ENT or the ophthalmology doctor so that we can detect the disease early and seek early treatment. The treatment for mucormycosis is very prolonged. It sometimes involves surgery of the sinuses. Sometimes we also need to remove the eye to save the patient's life. But if we detect this disease early, if we report early, then we can save life and save vision. So please identify and report early. Thank you.